এই সবাই আসছো? My dear students, I am introducing myself. I am Dr. Mohammad Zahidul Islam Khan, pulmonologist and internist. I am the student of this medical college. Is there any foreigner? Any foreigner? All of you are students of BDS, so your introduction is not required. Today I am going in brief. If time permit, I will go in details. I will go at first with the topics: common infections in skin. So there may be bacterial infection, viral infection and fungal infection. Most commonly is folliculitis. Folliculitis may be superficial and deep. Superficial folliculitis occurs mostly in unhygienic patients. Deep folliculitis may be boil and carbuncle. Boil, it is also called abscess. Carbuncle, so abscess can be occurred in anywhere of the skin. Carbuncle is usually associated with immunocompromised patient, most likely in diabetes mellitus or in diabetic patient, and it is situated mostly in the neck region. So boil and carbuncle is actually the same entity, but it is differentiated by the situation of its occurrence in the skin. It is caused by Staphylococcus aureus. So if you have done the surgery class, that boil and carbuncle all need excision before introduction of antibiotic. Sit down, please. There are scalded skin lesion caused by Staphylococcus aureus and toxic dermal lesion caused by Staphylococcus aureus. There may be viral infection, there may be warts, there may be fungal infection like tiniasis and candidiasis, molluscum contagiosum. Tiniasis is caused by ringworm. Depending upon its distribution, it is described likely Tinea corporis, Tinea capitis, Tinea pedis, Tinea cruris. Tinea cruris is in inguinal region. Tinea capitis is in a skull. Okay. So there may be leishmaniasis. The disease in internal medicine is Kala-Jar, which is caused by Leishmania donovans. So it may infect also the infection. It may also cause infection in the skin. Okay? There may be leprosy in the skin caused by Mycobacterium leprae. In leprosy, there is anesthetic patch, itching and some nodule, which is classified into lepromatous broadly lepromatous and tuberculous leprosy. Okay. Now I am going to urticaria, the other topic. Urticaria is also called hips. Urticaria is caused by dermal edema, which is caused by increased permeability due to infiltration of T lymphocyte, which increases capillary permeability. Have you any problem to understand? If you have any problem to understand, you will ask, then I will discuss in Bengali. Okay. Urticaria may be acute and chronic. If the duration is less than 6 weeks, then it is called acute urticaria. And if the duration is more than 6 weeks, then it is called chronic urticaria. Chronic urticaria, when present, you should think about some diseases like SLE, systemic lupus erythematosus, or arterial vasculitis caused by hepatitis B virus infection, and in some other autoimmune disease like rheumatoid arthritis, thyroid disease. Urticaria, chronic urticaria may be also present in pregnancy. Acute urticaria is associated with angioedema. Angioedema, have you seen any patient? Angioedema is particularly affect the facial region. There is swelling of lips and edema of lips and tongues, and there may be edema of trachea producing shortness of breath. There may be abdominal pain. Angioedema is an acute condition. So acute urticaria may be present with angioedema. So what are the investigations should be done in chronic urticaria? You should done full blood count, erythrocyte sedimentation rate, which may be increased in SLE. You should done some autoantibodies like anti-nuclear antibody or ANA, anti-DS DNA, which are positive in systemic lupus erythematosus. You should done thyroid function test, because some autoimmune disease is associated with other autoimmune disease. Okay, SLE is an autoimmune disease, so there may be other autoimmune disease. Urticaria can be present in thyroid disease also. So you should done all thyroid functions. Okay. You should done, if necessary, skin biopsy to rule out other disease. When there is diagnostic dilemma, you should done liver function test, because urticaria may be present with hepatitis B virus infection. In urticaria, when it is associated with angioedema, it is treated with steroid and danazol. In chronic urticaria, it is treated with steroid, and according to cause, the precipitating disease should be identified and should be treated accordingly. Okay, this is something about urticaria in short. In urticaria there are wheels. Do you know about wheels? Most probably someone have experienced in your life some wheels. In Bengali it is called allergy, like চাকা গ্রামে বলে দমরা দমরা ওঠে না, ওইগুলাই যদি ডার্মিসে হয় তাহলে এটা হইল আর্টিকেরিয়া। ঠিক আছে, আর্টিকেরিয়া ইনভলভ ডার্মিস। ওকে, নাও আই এম গোয়িং টু eczema. Eczema is Greek word, it means to boil. It is a synonymous of dermatitis, that is inflammation of dermis. Okay, eczema also may be acute and chronic. In acute eczema there is epidermal edema. So the difference in urticaria and eczema is, in eczema there is epidermal involvement. Okay, in urticaria there is dermal involvement. When eczema becomes chronic, there is thickening of the skin or lichenification of the skin due to chronic itching. There is hyperkeratosis of skin. So there is thickening of skin. There may be pustules and vesicle. Chronic infection may be secondary. Chronic eczema may be secondarily infected by virus or bacteria. Bacteria is Staphylococcus aureus and virus mostly herpes simplex. When herpes simplex is associated with chronic eczema, it is called eczema herpeticum. Okay. So when there is eczema, you should done some investigation when there is diagnostic dilemma or there is suppurated infection. So you can take swab from the chronic eczema if there are pustules or vesicles, swab for bacterial infection or viral infection. Okay, which swab may be cultured for organism. So culture and sensitivity can be done from that swab. You can do skin scraping test for identify fungal infection in eczematous lesion. Okay, and you should done some other investigations, routine investigations like full blood count, random blood sugar, or to detect diabetes mellitus, hemoglobin A1C, or other tests to detect diabetes mellitus. You should find out the other association of the patient in this eczematous lesion. Okay, you should done serum creatinine to find out any kidney involvement of this patient, liver function test, etc. So if there is eczema infected with bacterial infection, then you should give antibiotic, mostly flucloxacillin, because it is mostly infected with Staphylococcus. And if there is fungal infection, you should treat that in addition to treatment of eczema. Eczema is treated with steroid, which may be topical or systemic. Okay? Now there may be some varieties of eczema depending on the characteristics or the site of the lesion or in which age it is appeared. Like steatotic eczema, it is occurred in elderly patients in which their skin is dry and who take lipid lowering agent like atorvastatin. Seborrheic eczema, it is present in scalp and neck region or in upper back or in hands. Seborrheic eczema. Discoid eczema, it is coin shaped discoid lesion.